I'm Jim Breslow, and this is The Hidden Truth Show. You're about to see an excerpt from the latest episode from our podcast, Hidden Truth, Transgender Movement. This is Michelle Cretella. She's the president of the American College of Pediatricians. This group has been labeled a hate group. It's her position that you're not born trans. Watch the interview, and you make your own judgment. If you enjoy it, go check out our podcast, Hidden Truth Show, wherever you listen to podcasts.
So I'm president of the American College of Pediatricians, which is a national organization of pediatricians and other healthcare professionals who promote the optimal policies for children's health. We formed in 2002 because at that point, the American Academy of Pediatrics was the only professional guild that child health professionals could belong to. And they have essentially politicized medicine.
Now that academy, is that academy something that essentially all pediatricians belong to for the most part?
Because the Academy of Pediatrics is around 87 years old, it is the professional guild, the professional organization that virtually all pediatric trainees are inducted into. Our training programs essentially pay for membership to that organization. So for a while, a core group of us tried. One of our founding members is actually a past president of the American Academy of Pediatrics. So we really tried to have our voices heard, and we made scientific arguments as to why, life does begin at conception. Before Roe v. Wade, we as an organization talked about our patients at conception, and after Roe v. Wade, all of a sudden we're championing a woman's right to choose abortion and teenage girls' right to choose abortion without parental consent. Isn't this a problem? So that was the first issue that really got politicized, even within pediatrics. And by the time 2002 came around, gay marriage and gay parenting was the big issue. And the American Academy of Pediatrics board was poised to basically recommend same-sex parenting as identical to opposite-sex parenting, that mothers and fathers are basically either one or the other is irrelevant. And the bioethics committee, our bioethics committee on that American Academy of Pediatrics said, whoa, put on the brakes. Here's the evidence that you claim is sufficient when it's not. Let's look at the quality of the data. It's not here. If you want to be scientific, you have to say that the traditional family, a married mother and father, are optimal in raising children because we have all this decades of social science proof, and you have to recommend further study for alternative form of
this was an advisory committee that was saying this.
And exactly, and the American Academy of Pediatrics board completely ignored its own advisory committee and put forth the very poor research data at that point in 2002 and said, oh, no difference, no possible harm to children. Now we have several studies, not just Regnerus, but Dr. Paul Sullins has published at least 4 very large long-term studies documenting developmental harm to children who were raised by gay parents. And they have everything from more depression, anxiety, and ADD to impaired physical health compared to children raised in loving, traditionally married families.
So when we talk about pediatrics, it sounds to me like there is a psychological or psychiatric element to pediatrics.
Absolutely. It's not just, so in pediatrics, we're trained to take care of the whole child. We're trained to diagnose behavioral problems, psychological problems. What we don't do is provide psychiatric talk therapy, but we can advise parents in different approaches that they may take within the home that may help children. So
do you guys have special, to be a pediatrician, do you have special training compared to a general practitioner on issues of psychiatry and psychology?
you can, in my case, yes, I took that. I had a strong interest in pediatric behavioral health, and so I did additional electives and training in that area.
But at some point, if there's serious psychological issues, are you supposed to refer the child and the parents to a psychiatrist?
Right. So when I diagnose a teen patient with major depression, I will assess the child, the teen, and of course but with the parent as well. And if medication is indicated, I can initiate the antidepressant, but I would not do that without first connecting the child with either a therapist, psychologist, psychiatrist.
So, but based on pediatrics, it is theoretically appropriate for the organization to take a position on something like gay parenting.
Yes, you could certainly do that. As in the realm of pediatrics, it's physical, emotional, behavioral, social health. So you can certainly make a position statement on that, but you should be honest about the quality of the research you're basing your decision.
And what about, say, the American Psychiatric Association or whatever that organization is? Have they taken a position on something like gay parenting?
Exactly. Yes. Virtually every mainstream medical organization, they're professional guilds, basically. So the American Psychological Association, American Psychiatric, even the American Medical Association, have virtually all of them have come out came out and are still in favor of gay marriage, gay parenting. They all cite the same poorly constructed studies. So it's just symbiotic, feeding off each other.
So when you talk about the political element of it, I mean, describe what you're talking about. How did politics, in your view, infiltrate the academy?
It's part of being human. In one sense, it's part of being human. Every human being has a worldview, and I would say many of us who might be prone to a more conservative worldview are more likely to value being home with family, less likely to value climbing the ladder, so to speak. And what has gradually happened, not only in medicine, but higher, this is no secret, but throughout universities, so higher education, medicine, psychiatry, virtually any other public institution, liberal-leaning folks or individuals with liberal-leaning worldviews tend to make up the majority in power. And then within medical guilds, the subcommittees tend to be self-selecting. So for example, in the American Academy of Pediatrics, there's a subcommittee dedicated to LGBT health. Well, the individuals within that subcommittee basically just volunteer, and virtually all of them are lifelong LGBT activists. They don't go out of their way to include others who may have an opposing worldview. So ideally, you want folks, when it comes to social, that intersecting of medicine and social issues, you want to have folks on the right and on the left, scientists from the right and scientists from the left, to be part of a debate and a conversation about, okay, what does this data truly show?
Right. I mean, there really obviously shouldn't be any right and left when we're talking about science and medicine, right. But you're pointing out that unfortunately that's the reality.
Right. Or we don't have this problem when we're talking about, gee, how do you treat overwhelming sepsis with this particular bacteria? Right? That's just a hardcore scientific, let's test these antibiotics and figure it out. Easy. But when medicine collides with social issues like abortion, sex ed, LGBT rights.
So two issues that spurred your organization was the issue of when does life begin, right? And then the issue of gay parenting. And then there's now an additional issue regarding gender dysphoria. Is that correct?
Yeah, I would say the differences between the AAP and the American College of Pediatricians is more than just those issues. It's really about how can we come to objective scientific recommendations. It's about the politicization of medicine, and it's not. I guess it's in the sexual realm. It's also in terms of parent rights. The Academy increasingly, rather than viewing the pediatrician as a bridge between the child and the parent, increasingly the American Academy presents doctors as needing to protect children against their parents or protect children from their parents. So we differ. We differ in that way. We're more of a traditional Hippocratic physician organization.
Mm-hmm. How many?
And yes, one of the major issues we differ on now is in terms of gender dysphoria.
Yeah, and I want to dig into that one before I do. So how many members do you now have?
Yeah, so we are still significantly smaller than the AAP. We have 520 members right now.
Compared to
approximately 60,000 in the AAP.
And what about the religious component of it? Is there a religious component at all to your organization?
We don't have, we don't ask our members religious, so no, we're not faith-based or politically based. We are simply, we state our mission is to promote optimal child health, and our values are that we are pro-life and that we stand by the science that indicates the natural married mother-father family to be the optimal setting in which to nurture children.
So when you say you're pro-life, is that from a legal policy perspective? In other words, you would advocate for changing the laws or the Constitution to say that abortion should be prohibited?
So so on our website we describe ourselves as wanting to promote policies that will protect and honor life from conception to natural death. So we don't lobby, we don't engage in political activity of that nature. We're a 501c3 educational organization, but we provide the science that perhaps lobbyists could turn to argue for making abortion illegal, for example.
So you, am I right in saying that you hold that position that life begins at conception from a medical,
from a medical
perspective, right?
Yeah,
not from a religious perspective.
No, religion has nothing to do with genetics.
Right. So we're
not talking about souls or anything like that.
Right. Well, and by the way, I believe that you could believe that life begins at conception, but still theoretically support permitting abortion under certain circumstances.
That's right. There are folks, and they argue about personhood and so on and so forth. Correct. So no, we say from a genetic scientific standpoint, new life begins here, and we recognize that as something that should not be violated. Mm-hmm. So you're right. It's a different.
And what about for you? Does religion motivate your work personally?
So personally, I would say my faith, I'm Catholic, gives me the courage to speak out, because I otherwise would not. Speaking out against abortion, speaking out in favor of psychotherapy for unwanted homosexual feelings, speaking out now on the fact that, normal thinking matches reality is enough to get death threats. You get death threats, you get, it'll end your career. So
what about simply by joining your organization? If you're an active, professional pediatrician and they join your group, does anything adverse happen to them?
It could, yes. Many, the Southern Poverty Law Center, for example, has labeled numerous conservative organizations, including the American College of Pediatricians, as hate groups. They've been discredited, right? Even the FBI dropped them, but they still carry clout. So many of our members may join us, but not necessarily advertise that they belong if they're in, let's say, an academic institution, for example.
Your group was labeled a hate group.
We were labeled a hate group when we released the statement regarding, it's called Homosexual Parenting, Is It Time for a Change? And in that statement, which is still on our website, we highlight the evidence that mothers and fathers do matter and do make a difference, and that there's significant reason to be concerned that children could suffer when they're denied either a mother or a father. And that's the difference, right? If you have someone a woman who gets pregnant and she doesn't want to marry the father, and she's a single parent, well, that child may spend some time without a male role model or male fit, but it wasn't intentional. But whenever you have a homosexual couple who wants a child, whether it's through adoption, through artificial insemination or surrogacy, whatever, that's an intentional decision to deprive a child in every case of either a mother or a father. So,
does your group therefore think that essentially, for instance, gay marriage should not be legal?
We did oppose, yes. We opposed gay marriage because you cannot separate marriage from parenthood.
Did the Academy take a position on gay marriage?
They did. They were in favor, arguing that marriage rights were necessary because there were already gay couples parenting children.
Mm-hmm. So these groups do take policy positions, because I was just thinking to myself.
That's right. Right.
Yeah.
So we don't. That is true. The American Academy. We're often portrayed as, the AAP, the American Academy, is scientific, and the American College of Pediatricians, they're just an advocacy group. If you go on the American Academy of Pediatrics website, they have an entire section, and they literally have a committee dedicated to advocacy. And they have their members, they routinely will shoot out mass emails, hey, contact your legislators about this issue, and everything from gun control, climate change, you name it. They are very much involved in they want their members to make noise. So
you have concerns about children being raised by gay parents, but why be opposed to gay marriage? Couldn't you be okay with gay marriage, but have an issue with adoption or that type of thing?
It's impossible, legally speaking, to separate marriage from parenting. And we have legal consultants to our group as well, so we try to take that into consideration.
So the only reason you oppose, is it right to say that the only reason that you oppose gay marriage was because of the children issue?
Correct. So as an organization, as the American College of Pediatricians, our problem with gay marriage is that it fundamentally alters the family, and that the married mother-father family is the most pro-child institution we have. And so that was, for us, it's all one and the same, marriage and parenting. And in law, that's how it comes out as well.
Let's talk about gender dysphoria and how that has become a big issue for your group.
Sure. I'm going to say approximately maybe a good 3 or 4 years ago, I got a call from an obstetrician, OBGYN colleague of mine who had just seen a teen girl who was going to be transitioning to a male. And this OBGYN colleague of mine said, are you guys doing anything about that? Are you aware of this? Are you doing anything about this? Because these kids are going to be sterilized. And that, although I wasn't aware of that fact, she was the one who brought that to my attention. I decided to go to the literature, the scientific literature. It was extremely difficult to find. Now, my colleague was correct. Children who are put on puberty blockers before they mature their ovaries, if they're girls, or if they're boys, if they're put on those puberty blockers before they have mature sperm, and then go to the cross-sex hormones, they'll be permanently sterilized. I mean, and they're making these decisions at like age 9 to 12. And this is crazy. So that was what first drew the college into, all right, we have to really explore this and look further into it.
That was how many years ago?
So that was probably a good four years ago now.
So prior to that, really, the causes of, say, homosexuality or transgenderism was not really an interest of yours. Is that fair to say?
Well, I would separate. I would say that the treatment of gender dysphoria was not on our radar screen 4 years ago.
Mm-hmm. Okay, so you started looking into it, and what did you learn?
What was clear is that this is a massive, both social as well as medical experiment that's being carried out on kids around the world, but we're going to concern ourselves primarily with America. And our board of directors was just utterly dismayed. What we learned that what happened was in 2013, so even a bit earlier than when it hit our radar screen. In 2013, the American Psychiatric Association changed the name gender identity disorder to gender dysphoria. Now, the intention was to decrease stigma for those suffering with gender dysphoria. But once that happened, activists within the psychiatric organization and then also without argued, well, see, it's not a disorder at all. The fact that our thinking does not match reality is not a problem. It's only our distress that's a problem. And at the same time, adult transgender activists were saying, well, we're born this way, we're born this way. And look, those kids you say have gender identity disorder or gender dysphoria, they're really born trans. But there's no science to back it up. There's a lot of claims, but there's absolutely no science to demonstrate that anyone is born with hardwired thoughts, feelings, and behaviors.
Prior to that, had the Academy taken a position on, for instance, the cause of homosexuality? No. Actually, I kind of like. Can we focus on the gender dysphoria, because there's some overlap, but they're really two separate issues. Okay, well, yeah, I think that is a question, is, you know, whether they're separate or not, because gender. I know there's teaching or the writings out there that gender dysphoria leads to homosexuality, and or leads to trans, and that it's perhaps on the same continuum. You think that they're separate? It's your belief that they're separate?
Yes and no. I think that the topics are big enough. They need to stand on their own. I'm reluctant to talk about two in the same limited program.
Okay. So
if we could focus on gender dysphoria, where we think that comes from, and then how it overlaps with homosexuality. That's easier than.
Okay. Well,
I will tell you that the mainstream medical organizations present them as two entirely separate phenomena.
I mean, look, it's all the reason why there needs to be open discussion about all of this.
Yeah.
Because am I right in saying that one thing that everybody should take a step back and acknowledge is that, we really don't know.
These things are huge. There's so much we don't know. They're huge. So for purposes of a single podcast, I would say, you can go in the scientific literature, the psychiatric literature, and that debate, gee, is gender identity disorder, I mean, back when it was called GID, there were psychiatrists and psychologists out there who said, gender identity disorder, that's just a backdoor diagnosis for homosexuality, or it's a backdoor way of treating homosexuality. And then you had others like Dr. Ken Zucker, who was world renowned in treating children with gender identity disorder, saying, no, they're distinct. It's just that there's some overlap. So that's a debate that could be a podcast all to itself.
Yeah, and it sounds like you're saying there is a political difference between the two, right? Where you could talk about the medical difference and the political difference as far as how homosexuality is looked at versus transgenderism. For instance, should we treat transgenderism or a child showing gender dysphoria at the age of 5 versus a child who's showing perhaps indications that they might be gay?
Right. It's so subjective, right? It's so subjective because, in fact, that's the argument of a lot of. I've been contacted by LGBT activists who. They're very angry because they're saying, look, these boys who are being transitioned so young, they're just effeminate boys, and they would probably just grow up to be gay. And look at what we're doing. And they have a valid point, where everyone across the political aisle should be able to agree is that breaking sex stereotypes, that's not something you need to treat with hormones and surgery. It's okay for a little boy to pretend he's a princess or like to cook, or that's not a disorder that you want to throw chemicals at and put them at risk of sterilization. And yet that's essentially what we're doing, because there is no test to say this child is going to grow up and identify himself or herself as a transgender adult. There is no medical test and no psychiatric test that can do that.
Yeah, well, it really comes down to, doesn't it, what is the cause of it? Because if you are, quote unquote, born this way, then you would know that, oh yeah, he's showing the indications. That means he was born this way, and so let's take care of this while he's young so he doesn't have to deal with these issues when he's older. And I assume that's the position of the people on the other side of you.
That's what correct. That is what the medical side argues.
Right. So where is their evidence? What is their best evidence of born this way?
They will tell you that the latest, they've always argued, the proponents have always argued that it is either in the genes or in the brain. As it's been pointed out that if it were in the genes, when something's genetic, primarily genetic, then identical twins will have that trait close to 100% of the time. Like skin color, eye color, identical twins are identical in skin color and eye color 100% of the time, or darn close to it. When it comes to transgenderism, identical twins differ 75% of the time. So if identical twins differ that much, that means that genes play very little. We're made of DNA, so you can say, all right, our DNA contributes to everything to some degree. But when the vast majority of identical twins do not match for a trait, then that trait is more influenced by our environment, our growing up, and other things.
And
so they can't say genes.
And the studies say the same thing about homosexuality,
And you can that's also true for homosexuality. Yes.
In fact, that's the studies that I'm aware of. I had not heard about studies about trans just because there's so many fewer trans. I mean, seems like there probably aren't a lot of identical twins where one is a trans to even look at how large was that study even?
Yeah, they actually the largest study was by a Milton Diamond, and he had 110 identical twin pairs, I believe, and he found
where one was trans.
Where at least one was trans.
At least one was trans.
And he was looking at the world literature and the Netherlands, the Swedish countries that have.
Okay, so that would, in your view, that kills the gene's DNA argument.
Correct.
What about the hormone? The other thing you hear about is hormones.
There is no. So trans individuals, people who identify as transgender, have normal hormone levels. So that's not the issue. And if it were prenatal exposure to hormone levels that had a huge effect, again, you'd expect to see higher numbers of identical twins identifying as transgender, because for the most part, the majority of times those twins, the identical twins, they're in the same womb. With rare exceptions, they're also exposed to the same prenatal hormones. So
tell me about this release of prenatal hormone issue, because I've heard of this before. Is this a real phenomenon that women might during pregnancy release an inordinate amount of a particular hormone?
They would have to be exposed to testosterone somehow, for example, or other hormones. Normal pregnancy, so we're talking the vast majority of pregnancies, hormone exposure is determined by the fetus himself. If you have a male fetus, by 8 weeks gestation, that male fetus has testes that are developed enough to secrete testosterone. And that testosterone will bathe every cell of that male fetus's body. A female fetus does not have her own testes because she's female, and so she does not get that testosterone surge. So right there, it tells you that little girl babies are genetically little girls because they have 2 X chromosomes, and they've not experienced a testosterone surge because they don't have testes. So you can't get, the girl's brain is a girl brain. Every brain cell has the XX chromosomes. Every female fetus has her brain cells exposed to. So
she's a girl inside of a woman, and
right. So you can't have. They argue that. So initially they argued it was in the genes, but no, it's not. The twin studies don't support that. Then they argued, well, the brain and the body are just on different pages, and they have the brain of the opposite sex, which is just ridiculous because you can go to science and prenatal development, and we know that from conception, female embryos and fetuses, they don't have the Y chromosome. They have X chromosomes. The female fetuses do not secrete a testosterone surge. The male fetuses do. So you're not born with opposite sex brain.
Thank you to Michelle Cretella for providing that interview. If you want to listen to the rest of that interview, go to the Hidden Truth Show podcast, wherever you listen to podcasts. We're doing a deep dive into the transgender movement. Hidden Truth Show podcast, wherever you listen to your podcasts.